We are back with Dr. Eva Fisher talking about ADHD, and we talked about the hyperactivity form of it. What's the other form of ADHD?
Well, the other form of ADHD is mostly about inattentiveness or inattention. Children they don't have the hyperactive part, but they tend to be falling through the cracks a lot in school, because if you imagine a scenario with a child in a classroom and the child is not making any disturbance, but they're looking out the window, they're dreamy, they're kind of spacey, they're tuned out, they have their hand propped on their arm and they're just staring into space. If the teacher calls their name, they may very well not hear, or if the teacher asks them a question, they're just so tuned out they don't even hear the teacher asking them a question. So then the teacher would accuse them of not listening or being disrespectful, but that's not it at all. They're just very absorbed in their own mind, and they're thinking about very important topics. It's not that their mind is empty. They're doing stuff in their head, and very often they're very creative, they're very bright. So, and the other thing about attention deficit disorder is that it has nothing to do with intelligence. I've seen children who are very gifted, who have a diagnosis of ADHD. I've seen children who are in the average range or high average range or low average range. It has really no relevance at all to innate IQ. It's a completely different kind of behavior pattern.
Right.
That's very interesting to point out, in fact, and also I was curious because you mentioned about the people just staring off and sort of not paying attention in class and what have you. I've heard that there can be a connection sometimes with vision problems. Or can you expand on that? Have I heard correctly, or is this one of the myths? Or
there's two possibilities: that we have a lot of sense modalities. We have to have good vision in order to read. We have to have good hearing in order to hear. What I find with children with ADHD is that they're really, really good at hearing. Like whatever they can't pick up on the classroom, the teacher just goes too quickly and they haven't been able to decode the information they need in order to do their homework. Right. So you see them getting real busy talking to other kids in the class. What did the teacher say again? What do we have for homework again? And they compensate by asking other kids, and that way they learn. So they kind of get around it, and they also save face by being able to say, or not, they don't have to say, well, I really didn't have enough time to read what was on the homework. So they don't have to say that, but they just ask other kids questions.
So what then is the treatment to ADHD?
Well, the treatment is pretty straightforward. The first thing to do is, if you think your child has an attention problem, the best thing to do is to call your pediatrician or your family doctor or a psychologist. But very often it's the doctor who will give you a referral to a psychologist. Right. And the psychologist will give your child a number of tests, as well as giving you some checklists to fill out, so that we can get a sense of what's happening at home and also what's happening in the social situations. And then we give another checklist to the teacher to see what the teacher's impression is of the child in the classroom. And then we do some very specialized tests in our treatment room to determine if the child really has a hard time focusing. And some really fun tests. The kids really like it. It's on a computer and they get to play with the mouse and they get to have a lot of fun with it. So that's the way that we would determine if there is a diagnosis. As far as the treatment, once there's a diagnosis, then we would have to talk with the doctor about the treatment. There's many different types of medications. There's Ritalin, there's Cylert, there's Concerta, which is a time-release Ritalin. Right. They're all in the classification of stimulants. And with children, there's a paradoxical effect that they don't stimulate the child. Well, actually, they do stimulate the child a little bit, but that also helps them calm down.
Yeah.
And be able to settle themselves down in the classroom enough to be able to focus. So.
But it's not, is there a combination of drugs and counseling? I mean, because I'm thinking, I mean, it's one thing to put them on and then, eventually down the road they'll probably want to get off of it, right?
Yes, yes. And in some cases they are able to get off it by adolescence. In some cases not. Right. But yes, you're absolutely right that the drug does have some interference with concentration at some times. But the reason to give the medication is to help the kids settle down and to be able to focus in school. And very often I see that parents will say, well, why do we have to give the drug after school? the child doesn't need it after school. And a lot of times children will say, I feel funny taking this drug. Like there is a kind of a difference in their internal experience. So we just decide, well, just give the child the medication in school, and after school, don't give it to them. Or just give it to them when they have to do their homework. And then afterwards, just don't give it.
Right.
Dr. Fisher, is there, I mean, in this age of internet, is there a problem
That's a
with
wonderful question.
misdiagnosis? Because I'm sure people go on the internet, they Google their symptoms or whatever. Does this happen often? Do
We
you
have
see
a term for those kind of people. It's called cyberchroniacs.
That's fantastic.
And if ever you worry if you're going to have something like medical students, first-year medical students go through the whole spectrum of thinking they have every disease under the sun. Because as soon as you read about the symptoms, you think, oh, I have that. Oh, I have that. I must be like dying of cancer, you know. But it's not true because you're just amplifying little symptoms out of proportion.
Right.
So, and the same thing when you go on the internet, you think, oh, I have this, I have that. I must be really bad. I must be used in a bad way. But it's not really that.
So contact a professional.
It's the best thing is to contact a professional.
And you mentioned before, we have a little bit of time left, about the good side
Yes.
of ADHD.
Yeah, the good news about ADHD is that these children tend to be growing up and having a lot of success in their work life.
Right.
And they tend to be very well suited to types of jobs where you have to be outside of the office, like sales, like marketing, like hotel industry.
Entertainment business.
Entertainment business.
You mentioned a few before. Thank you so much, Dr. Fisher. Really appreciate having you here. Yeah, I mean.